Well, good morning, everyone, and it's time to talk about your best friend with Iowa Veterinary Specialties, and we have a very special guest joining us in our living room here this morning, and a very unique individual in her own right, we might add to, and you're going to find out more about this in the next couple of minutes. Dr. Shauna Greene is joining us. She is over at Iowa Veterinary Specialties. She's an American College of Veterinary Internal Medicine certified doctor and a very unique doctor. Thank you so much.
Thank you for having me. It's great to be here.
Absolutely. Okay, so we're talking about something specific today, and maybe not the greatest topic of conversation, but an important one to have, especially when we're considering our best friends, which can often be four-legged ones, and that's cancer.
Correct.
So how often are we considering cancer when it comes to our best friends?
Cancer is unfortunately being diagnosed more and more often. It's estimated that about 12 million dogs and cats will be diagnosed with cancer every year, which is a very similar number to what we're seeing in human medicine.
Wow.
The reason for that is there's many reasons. Number one is that our pets are more and more a part of our family. They're basically, an integral part of our life, and so we're diagnosing them more because we're more aware of what's going on with them. The other reason is that we have more advanced diagnostics. So at Iowa Veterinary Specialties, we have the capability of doing abdominal ultrasounds, radiographs, CT scans, biopsies. So we're able to get more answers for people, whereas in the past, a pet would get sick and we maybe didn't know why they were failing.
You're talking 12 million animals.
Correct.
And that's probably a low estimate, too.
Correct.
And for the majority of people that are out there that do have pets that you have for a long period of time, we were talking about this before we went on camera.
Yep.
Chances are really good if you lose your best friend,
yep,
it was probably from cancer.
Correct. Across the board, about 1 in 4 animals will be diagnosed with cancer in their lifetime, and about 50% of pets over the age of 5 will unfortunately succumb to cancer at some point. So.
Do we know why this is? I know you said we're becoming more aware,
correct,
which is one reason, but has the diet changed? Has the environment changed?
We certainly, as we go down this road, we definitely have a lot of issues at play. Certainly genetics are a portion of this. Diet can definitely play a role. We're certainly becoming more aware of different diseases that are diet related that we weren't aware of in the past. Again, people are more willing to, or more willing and able to get their pets into veterinarians and figure out what's going on with them. And then, certainly finances can play a role, and a lot of people now have pet insurance, which allows them to be able to,
pursue
take the next step.
Like that.
Correct.
Yeah.
And now let's talk about that really quick, since you did mention pet insurance. Are you a fan?
I am a fan. Certainly I think it's very helpful, especially we're not planning for these things. Just like with the people, cancer unfortunately affects everyone. And so, certainly you can have a very, very healthy pet, and within days they can become very ill. And so being able to not have to make decisions based on finances,
and that happens a lot. And I'm sure you see that a lot too. Say, I can't afford, unfortunately, to treat my best friend.
And that's why, again, whenever I approach a patient who has cancer, I want to take like a 3-step approach. Number one, I want to be able to tell the owner exactly what type of cancer their pet has. Number two, I want to be able to tell them where in the body is it affecting them. So is it just a skin mass, or is there something going on internally? And then number 3 is giving them options, which I think is the most important part of my job. When you come in to see me, certainly I will offer you a variety of things that we could do, and I can give you expectations and outcomes if we were to do surgery, if we were to do chemotherapy, if we were to do nothing, what are the things that we would anticipate would happen if we go down that road? And so if you can't necessarily afford option A, then there's going to be an option B or an option C. And again, the focus of my job is to offer these options so that you can make the best decisions possible for your circumstances, but most importantly, to give your pet the best quality of life possible.
Now, what are some of these cancer diagnoses that that are most common that you see at your place?
For dogs, unfortunately, 25% of dogs that get cancer will get a lymphoma. It's very similar to non-Hodgkin's lymphoma in people. So the most common thing that we'll find is that you'll be petting your dog and you'll feel big lymph nodes. So lymph nodes in the neck, just like we feel with people, sometimes in the shoulders or the armpits or the legs, and the pet will be acting perfectly normal, and you'll take them in, and the best thing your doctor can do, again, is to get a sample of whatever is going on so that we can confirm, is this cancer or not, and then we can, again, move to the next step for treatment.
Right. I'm just happy to hear that there's options, because I think even as humans, if we hear the word cancer,
it's very scary.
It's very scary, and you instantly think of the negative as opposed to, okay, what can I do next to have
But the good news
rate?
is just like within human medicine, there are definitely cancers that are curable. We can definitely get rid of certain types of cancers, so soft tissue tumors, skin tumors, oral tumors. Some of them are very curable with appropriate therapy. unfortunately, with cancers like lymphoma, which we see very often, it's not necessarily curable, but it's very treatable. So we can get that patient into remission. We can get the cancer under control. We can give that pet a normal, excellent quality of life for months and months, or even sometimes years. And although we may not be able to cure that pet, we can definitely still have them with us for a long period of time.
So there are undeniable parallels between your pets and humans, correct?
Absolutely. And that's where I think people sometimes get concerned as well, is that they hear terms like chemotherapy. And if you've had a friend or family member that has went through chemotherapy, they can unfortunately get really, really sick.
Absolutely.
Because in human medicine, the way I like to coin it is that, they want to cure your cancer at all costs, which, everybody, that's the goal. And I want to do that for your pet as well, but not at the expense of them getting sick, feeling poorly, and having diminished quality of life, because every minute counts. And again, we don't have pets as long as we do for people. So if I can have a pet in remission for a year, again, that's equivalent to 5 to 7 years for a person.
That's true. Think about that.
Which is pretty good, when you look at comparable statistics for humans and pets.
You want to know something? The name of the place that you work, Iowa Veterinary Specialties, this really has special meaning now because you're a veterinary oncologist.
Correct.
And this is really a specialized field. Tell everybody how many veterinary oncologists there are in the nation, and then tell everybody how many are here in Iowa.
Yeah, so there are approximately 400 board-certified veterinary oncologists in the United States. What that means is that we went through veterinary school, and then we've actually done about 4 additional years of training specifically for our area of expertise. So I myself studied up at Iowa State for veterinary school, and then I did a medical oncology residency at Purdue. And then I'm from Iowa, so it was always my goal to come back here, and I've been back in Iowa for about 3 years. We're fortunate here in Iowa that we actually have myself at Iowa Veterinary Specialties, and then we have 2 board-certified oncologists up at Iowa State University as well.
So that's it?
That's it.
Iowa Veterinary Specialties.
Correct.
And Iowa State at the veterinary school. Wow.
Unbelievable.
That's impressive.
Well, we're just blessed to have incredible specialists like you in our area.
Thank you very much. I really enjoy what I do, and I'm very lucky to be part of Iowa Veterinary Specialties.
Not to pinpoint breeds or anything like that, but does diagnosis kind of go with certain kind of
There are. So, when I have a
breeds?
patient on my schedule, I can sometimes predict what they're going to have based on, the signalment or the breed, the age, and then also the symptoms. So we were just discussing prior to going on air that, there are certain breeds of dogs, unfortunately, that genetically have an increased risk of cancer. For instance, Scottish Terriers have a 18 times more likely risk of getting bladder cancer than any other breed of dog. Boxers and Golden Retrievers, unfortunately, are at the top of the list for lymphoma, many different types of cancers. Certain breeds of dogs like Golden Retrievers and German Shepherds will get splenic masses. So again, there are certainly certain specific breed types of diseases, but just like with people, any dog can get any type of cancer, and cats as well.
Now, on the other end of the scale, what about breeds of dogs that typically don't have a high rate of cancer?
Yeah, so again, you have that hybrid bigger with mixed breeds. So, again, they're usually at a lower end of the scale, but we do see, unfortunately, every breed of dog out there. But, the less common breeds we tend to see less commonly because, again, we just don't see them as much. And potentially they may have less of a genetic risk there, too.
And the thing that's special.
So go rescue a good mutt.
That's right.
Yeah.
Yep.
There you go.
Absolutely.
The thing that's special about your place, too, is that you can treat what you diagnose.
We can. So we do offer a full variety of treatment options. So again, if we have a dog that comes in with a skin mass and we can remove it, we certainly have surgery as our first line of defense. If for some reason the cancer has spread, then we would use some sort of a systemic or whole body treatment, and that's where we would use something like chemotherapy or immunotherapy. We have a really specific type of treatment for dogs who have an oral tumor called melanoma, which is a melanoma vaccine. So when we think of vaccines, we think of preventative, like for rabies or distemper, but this is actually a treatment that specifically targets the tumor cells and uses the immune system to attack the cancer.
Wow.
So it's pretty amazing. And again, some of that research was actually moved into human medicine. So again, what we learn from humans, we can use in animals, and what we've learned in animals, we can use in humans.
Amazing. The work and the equipment that you have at your facility and the expertise you have at Iowa Veterinary Specialties. And it's a 24-hour facility.
Absolutely. So get more details, head to their website, give them a call, or just stop on by. They're there to help you and your best friend. It's amazing to hear how technology is advanced.
Put that number in your phone, folks. Put that number in your cell phone, 280-3100, 280-3100, because you never know when your pet's going to need some emergency care or care in general, and this would be the place to go. Thank you so much, Doctor, for coming in.
Absolute pleasure to talk to you today.
Thank you guys very much.
Wonderful.